Hello, everyone, and thanks for joining COVID-19 Managing an Evolving Patient Population with Health Information Systems webinar. My name is Jordan Leibovitz, and I'm part of the marketing team here at IMO. Before we get started, I want to take care of a few items for those attending. First off, this webinar is being recorded and will be available to you for future viewing. Throughout the session, all attendees will be in listen-only mode, and if you have any questions, please type them into the questions section on your GoToWebinar console. At the end of the presentation, we'll have a Q&A session as well, and we'll try to get to as many questions as we can, but if for any reason yours is not addressed, someone will be able to follow up with you after the presentation. We like to keep things interactive, so throughout the webinar, we'll be launching poll questions for you to answer. Today, we have three presenters from IMO, Dr. Julie Glasgow, Clinical Terminologist, June Bronnert, Senior Director of Global Clinical Services, and Riti Chauhan, Senior Product Manager. The content of the webinar today will focus on how different standard coding systems are guiding COVID-19. You'll become familiar of IMO's detailed set of COVID-19 problem and procedure content, and you will also learn how IMO Precision COVID-19 sets can help your organization. As mentioned before, if you have any questions or comments while our presenters are speaking, please type them into the questions on your GoToWebinar control panel. And with all of this being said, I would like to pass it over to Riti Chauhan.
Thank you, Jody. For those of you who are not familiar with IMO or Intelligent Medical Objects, we are the innovators in clinical interface terminology. We have a very strong presence with over 500,000 physicians and 4,500 hospitals using us daily. At IMO, our foundation has always been clinical terminology, in which we have partnered alongside healthcare organizations to help them capture clinical intent, make better clinical decisions, and capture diagnosis codes for billing, with mapping to over 2.4 million terms in clinician-friendly language.
All right, we're going to test out our first poll question. So if you could refer to your screen and answer the question. Your organization is currently heavily engaged in the care of COVID-19 patients, moderately impacted by the care of COVID-19 patients, minimally impacted by COVID-19, or not at all impacted by COVID-19. Give you a few more seconds to answer. All right. Going ahead and close out. Thank you. Back to Riti.
So the world today is in the midst of a pandemic caused by severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2. Till date, about 3 million confirmed cases of COVID-19 have been reported worldwide. While the world slows down, the healthcare organizations are operating on an overdrive. As they respond to COVID-19 pandemic, they need to accurately document problems and diagnoses. They need to monitor patient population, continuously evaluate management protocols in place, and effectively engage patients at the point of care. IMO is committed to supporting our healthcare partners in their mission to manage and minimize the spread of COVID-19. In this rapidly evolving situation, IMO has responded by providing the most updated terminologies that help healthcare organizations accurately document COVID-19 related problems and procedures. As new clinical concepts and codes for the new coronavirus outbreak are created, IMO will continue to assess the clinical and documentation implications of these releases and respond as quickly as possible. Additionally, IMO has also created value sets to help identify and monitor COVID-19 related problems, diagnosis, and labs. It is offering them as IMO Precision COVID-19 sets to all customers free of charge. I will now hand it over to June Bronnert, Senior Director of Global Clinical Services here at IMO, to please discuss the mapping of the new COVID-19 standard codes to IMO terminologies.
Thank you, Reedy, and welcome everyone. We know providers are balancing many different aspects of COVID-19. These ranging from caring for patients with and without COVID-19, along with the changing business aspects of providing the healthcare services. And as the pandemic has rapidly evolved, so have the rules and guidance from various authoritative sources on addressing the healthcare services. This situation is not limited to the United States, but includes many locations across the globe. We will look briefly at the international responses from an ICD perspective, as well as a procedural industry coding standard view, and how IMO supports the provider's management of the information. And turning our attention to ICD, the next slide will show the global response. And so here the World Health Organization in March activated code U07.1 and U07.2 with the code descriptors listed on the slide. WHO provided further guidance on when to report which code for global surveillance. Other countries such as Australia, Canada, and the United Kingdom, as you can also see on the slide, followed WHO's lead and activated at least 2 U codes. Australia has adopted a U06.0 code as well for COVID-19 ruled out. And while each system is following WHO's naming convention of the virus identified or not identified, the timing of the title changes varies across the systems, and as those systems update, so will IMO's code title descriptions. The ICD systems also have published coding guidance and updates in February and March. And so, for example, the UK published guidance on March 26th and updated their guidance on March 31st. Canada published guidance on February 24th and updated their guidance in March 26th, while the United States published guidance on February 20th and March 18th. The topics covered for the reporting of confirmed cases, along with suspected exposure or ruled out COVID-19 cases. And the guidelines include not only the recently activated U07 codes, but other existing ICD codes to ensure proper reporting of various clinical scenarios. Of note, ICD-10-CM implemented only U07.1 with the code descriptor title of COVID-19. And as the ICD-10-CM official coding and reporting guidelines state, code only a confirmed diagnosis as documented by the provider, positive test result, or presumptive positive test result. So as you can see, the new codes and the guidelines occurred frequently, and IMO monitored the changes and continues to monitor the systems for updates. And on the next slide, we will look at examples of mapping changes in detail. So prior to WHO activating U07.1, the code map was B34.2, the coronavirus infection unspecified site for WHO, the UK, CA, and AM maps. B34.2 was the ICD-10-CM map until the guidance from February 20th was released, and the maps were updated based on this guidance that noted the diagnosis of B34.2 coronavirus infection would generally not be appropriate for COVID because the cases have universally been respiratory. And so thus the code maps were updated to J22 respiratory and B9729 coronavirus as cause of disease classified elsewhere based upon the guidelines. The maps changed again for ICD-10-CM due to the announcement of U07.1 being implemented for April 1st, 2020. And IMO remapped our terminology based upon the rapidly evolving coding guidelines to ensure providers have the most appropriate code maps for managing their patient population. We'll now turn our attention to non-ICD coding industry responses, and we will see examples from SNOMED and LOINC. So this slide shows a couple examples of the new codes released in response to COVID-19. SNOMED and LOINC provided these codes, and LOINC published pre-release terms in February, March, and April to support the industry. Keep in mind, pre-release terms are considered still in development and subject to change prior to the next standard LOINC release. IMO continues to monitor the organizations for new and changing codes. And we will look at two more industry examples on the next slide. Here are examples of CPT and HCPCS codes related to COVID-19. The Centers for Medicare and Medicaid, CMS, and the American Medical Association, AMA, released these new codes to support providers. And again, IMO continues to monitor their activity for the industry to ensure that our terminology and code maps are up to date to support our providers. The next slide shows how all of this activity translates to IMO maps. Here you can see how clinically friendly procedure terminology aligns to the various mappings. And again, you'll see the SNOMED, CPT, HCPCS, and LOINC codes for the clinically friendly term. And as these systems evolve, IMO will update the maps accordingly to ensure the dictionaries are future-proofed. And finally, the coding changes are happening across the globe for a variety of systems, and the changes are happening at an unprecedented pace. And these changes include guidance along with new codes, and IMO is keeping pace with these changes across the systems to ease the maintenance burden on providers to support their efforts of caring for their patients. And now I would like to turn it over to Dr. Julie Glasgow, who will describe IMO's terminology and precision sets for COVID-19 in depth.
Thank you very much, June. Yes, this is Julie Glasgow. Happy to be with you today. One of the main focuses of this presentation is our value sets or precision sets. But before we can deep dive into a description of those, it's really helpful to take a look at their building blocks, which is IMO terminology. So IMO is a clinical interface terminology, which means that its intended use is to express clinical information in the same way that clinicians do. So that means we deal with a lot of synonyms, we accommodate a lot of acronyms, abbreviations. So SARS-CoV-2 means the same thing as 2019 novel coronavirus, which means the same thing as COVID-19 virus. And IMO lexicals are the clinician-oriented descriptions that we assign to clinical concepts. Each of our descriptions has a unique numeric identifier that's associated. It's called the lexical ID. So it's important to realize that IMO lexical IDs never change. They're the same across all instances of our data. So every health system that uses IMO has the same specific lexical ID, meaning exactly the same thing. So even when the mapping rules for a given COVID-19 diagnosis change, the lexical ID will stay the same. As June mentioned, the mapping rules for COVID-19 related diagnosis have already changed a couple of times, and they may well change again, but the IMO lexical ID will remain the same throughout all of these changes. So the COVID-19 diagnosis documented using IMO back in early February will be a piece of data that you will always be able to find again via the IMO lexical ID. This makes retrospective analysis so much easier. The IMO lexical ID also makes interoperability possible because everyone who's using IMO lexical IDs is speaking the same language in their data. Next slide. So as we've mentioned, our lexicals are all mapped to standard coding systems. And one pattern we see a lot is that our diagnoses can capture more clinically relevant details in a single data item than standard coding systems do. So for instance, pneumonia due to COVID-19, that's a single description with a single IMO lexical ID. It's mapped to two different SNOMED codes and two different ICD-10 codes. As you know, ICD-10-CM has only one code, U07.1, to represent a diagnosis of COVID-19, but the manifestations of disease, like the pneumonia, are captured in a separate code. And to further complicate the coding picture, sometimes U07.1 is supposed to be listed first. Other times it needs to be listed second. This can make it a challenge to find and analyze patient data, and IMO lexicals can help solve this problem. Let's see, continually updated. Our content is always being updated. Our first release of 2019 novel coronavirus problem content was back in January with 15 lexicals released. Our COVID-19 content is approaching 200 lexicals now, and we're always adding more. We update our content in response to coding changes, but also at the request of our users. It's very common for us to receive a request to create a new lexical, and we will often do so for sound clinical concepts. And of course, we're anticipating even more evolution as the clinical picture continues to develop. Very recently, coagulopathies, blood clots, strokes, they're starting to emerge as a manifestation of COVID-19. So we are anticipating changing in response. So our two major domains are the problem domain and the procedure domain. We've created COVID-19 value sets for both of these areas to accompany our individual terminology items. And I'll also mention that we're working on making our COVID-19 content more readily available to everyone. We want any healthcare organization who could benefit from our terminology and its associated value sets to be able to use it freely for COVID-19 data representation and exchange. There are also national groups that have formed to coordinate health IT efforts. We're involved in those. We understand how hard the frontline healthcare providers are working to care for COVID-19 patients, and we want to help. Next slide. Let's see, so looking more closely at our problem terminology, as I mentioned, synonyms play a really big role here. We do always find ourselves having to balance providing a really varied set of ways of expressing a diagnosis with providing too much clutter. So we're always playing that balancing act. And we change our content as situations change. So back in January, it was not uncommon for this virus to be referred to as the Wuhan coronavirus. So that phrase was included in our content initially. Over time, it's become clear that this is a problematic description, so we no longer provide it to populate charts. However, if someone used a Wuhan coronavirus IMO lexical back in February, that problemless item isn't lost. Our value sets can still find it via its lexical ID. So next slide. We're going to dive into some of the flavors of problem lexicals that we provide. These ones all represent diagnosed cases of COVID-19. These are just examples. As I mentioned, we include manifestations in many of these, pneumonia, sepsis, hepatitis media. Also, there's the clinical diagnosis of COVID-19, which can be made even in the absence of a positive PCR test. And by the way, that one also maps to U07.1. Next slide. We include a variety of problem items that are a lot less cut and dried. Items that can help us track where a patient is in the investigation process. Items that capture exposure. We have infection ruled out. Next slide. We have some problem items that capture a recovered state. And we do actually include some items that we can't actually use yet. So problem items that capture information related to COVID-19 vaccines. Even though a vaccine is not available yet, some of the SNOMED editions added concepts to capture this information. So we decided to go ahead and create the corresponding new lexicals. So this way, there won't be a time lag as the availability of the vaccine emerges. Next slide. So turning our attention to the procedure side of things, we have dozens of lab procedures for COVID-19, including the original PCR test and the newer antibody assays. These are mapped to CPT, HCPCS, LOINC, along with multiple editions of SNOMED from around the globe. We also include the tests that detect any MERS or SARS coronavirus, including the novel 2019 virus. Of course, procedures don't always mean labs, and we have a variety of other procedure items. Here are some examples: specimen collection. The UK developed a severity assessment specifically for COVID-19, so we included those items. And again, we have vaccine-related items for that great day when we have a vaccine to administer. So to summarize what we just covered, IMO problems and procedures are individual atomic data items to capture specific information for patient charts. They're associated with unique, consistent lexical IDs that don't change over time or from location to location. That supports interoperability and analysis. And we are always changing to keep up with developments. So recording specific information in individual patients' charts is a central activity in medicine. Equally important is the ability to go back and find patients based on that information. And that's where value sets come in. IMO precision sets are collections of value sets that are used to find patients based on specific characteristics. Familiar uses of value sets include things like finding patients with hypertension, diabetes. We've built value sets that can find patients with COVID-19 and related states. So whether they're inpatients or outpatients, you want to keep track of your COVID-19 patients, where they are, how they're doing. So these sets allow you to do that in a variety of ways. You can use the problem value set on your inpatient, for instance, to localize COVID-19 patients and ensure that your cleaning and disinfecting schedule is appropriate in prioritizing their rooms. If you want to monitor a COVID-19 patient who will be cared for at home, their family members may or may not be exposed. These value sets make it easier to find these patients for things like education and follow-up. They support analysis. You can answer questions like how many of your COVID-19 admissions were emergency admissions of known positive patients you're monitoring at home. So our next slide is our second poll question. So back over to Jory.
Awesome. Thanks, Julie. All right, if you could all refer to your screen right now. How is your organization utilizing value sets to manage COVID-19? Clinical decision support, best practice alerts, reporting, cohort identification, analysis, or none? I'll give you a few more seconds to answer. All right. Okay, going ahead and closing out. Thank you so much.
Thank you, Jory. So our initial build for COVID-19 includes 4 value sets, 2 each in the problem and procedure domains. We are, of course, anticipating more as need increases and the situation develops. Next slide. So the problem value set include one for diagnosed patients. Since a positive PCR test is sufficient for diagnosis of COVID-19, those items are included. This set also includes COVID-19 diagnoses that capture manifestations and complications. The other set includes patients who have other COVID-19 related problem items, but not an outright diagnosis. So suspected, exposed, patients under investigation. Next slide. So looking closely at our procedure sets, they're very LOINC-centric. One set is comprised of IMO lexicals that represent SARS-CoV-2 LOINC codes. So these are codes for the results side rather than the ordering side. And if you are a IMO core procedure user, this set may be useful to you for finding patients with these results. The other procedure set includes only LOINC result codes. If you map your results to LOINC, this set may be useful to you. Note that there are LOINC codes that identify which test was done. Those are the codes that are in this set. They aren't the LOINC answer codes, which capture the negative or positive result itself. So these codes are the label for the lab result that has come back. And again, we're anticipating expansion of our COVID-19 precision set content as the situation develops. So now we will turn the presentation back over to Reedy, who will talk more about precision set use cases. Thank you.
Thank you, Julie. So how can healthcare organizations take advantage of IMO Precision COVID-19 sets? By using these value sets to create patient cohorts. For example, you want to know all the patients in your organization with confirmed COVID-19 infection, or all patients who have been exposed to or suspected of COVID-19 infection. Or maybe use COVID-19 lab results value sets to answer the question, which of my outpatients have had the COVID-19 lab results come in today? A staff person can go through and manage these depending on the result. Negative patients need to be contacted and told of the result. Positive patients can have their charts sent to a clinician for further evaluation and follow-up. These value sets can also be used for clinical decision support. For example, use a value set to trigger alerts to enroll patients in a monitoring program or to engage patients at point of care. For instance, if you have a patient coming in and you know they have COVID-19, you can take precautions and direct them to the appropriate part of your institution to ensure the safety of other patients and staff. Use these value sets to identify and follow up with patients suspected of or exposed to COVID-19 to provide continuity of care. Is another example of how organizations can manage COVID-19 patient population using these value sets. And these value sets can be used for reporting, for retrospective analysis, or for managing hospital resource utilization. For instance, determine how many COVID-19 inpatients you have and where they are in your hospital so that you can move supplies and equipment safely and appropriately. These are some examples of use cases of IMO Precision COVID-19 sets that can help a healthcare organization manage COVID-19. The healthcare industry is usually challenged with providing precise care effectively using the healthcare information system and mitigating risk. With COVID-19 pandemic, these challenges are even more acute. IMO can help address these challenges. IMO Precision COVID-19 sets are clinically curated using the latest codes and IMO's powerful terminology library. As a result, they can capture relevant details of a patient's condition, support accurate care decisions in high-risk population, and create precise patient cohorts for various initiatives. An organization can get a better return on their investment in health information system by using the data stored in the system, along with the IMO precision set, to identify patients with COVID-19 related problems and procedures, analyze the effectiveness of their management protocols, and report on COVID-19 cases. Using clinically curated and continuously updated IMO precision COVID-19 sets makes sure that the patient cohorts being created are more accurate and allow a healthcare organization to be confident of providing the right care to the right patient, reducing the risk of false positives and negatives, thus mitigating risk. The IMO Precision COVID-19 sets are intended to reduce the burden of creation and maintenance of COVID-19 related value sets so that the healthcare organizations can focus on patient care.
All right, if you could refer to our last and final poll question, what other COVID-19 related value sets are you interested in? Comorbidities, surveillance, post-recovery, or other? All right, just a few more seconds. All right, thank you so much. I'm going to close out. Back to Riti.
The IMO Precision COVID-19 sets is one library in our IMO Precision Sets offering. IMO Precision Sets delivers a rich and a constantly expanding library of use case-driven, clinically curated and maintained value sets, which allows organizations to find precise and granular information in the vast ocean of structured EHR data. We have value sets to create patient cohorts for high-impact chronic and acute conditions, to help with clinical staging of cancer, to identify patients at risk of unhealthy alcohol use or opioid use disorder. These are some of the examples IMO Precision sets can be used for. We continue to evolve and grow our library. In closing, IMO is here to help, and we are committed to supporting our healthcare partners in your mission to contain and manage the spread of COVID-19. We will continue to monitor the evolving situation and respond in a timely manner to enable healthcare organizations respond to the COVID-19 pandemic. With that, I will turn it over to you, Jordan, for Q&A.
Awesome. All right, at this time, we'll be kicking off our live Q&A session. If you have any questions from today's webinar or questions you had coming into the webinar, please enter them now, and our team will begin answering your questions live. Just so you know, as we start receiving questions, there might be some brief silence. Here's a question. How do you use the precision sets in our EHR since most of the values are captured in the EHR?
Jody, I can try to answer that question. We make the value sets available as flat files. Our request is that whatever process you use to integrate publicly available value sets within your EHR, publicly available value sets such as what you can get from VSAT, ECQM value sets, another publicly available value set, whatever process you have in place to integrate those value sets within your EHR, you can use the exact same process to integrate the value sets we provide for COVID-19 into your EHR.
Another question came in. I already built value sets based off NOMED codes. Why should I use IMO precision sets instead?
I can answer that. One is our precision sets use IMO lexicals, which contain a lot more descriptions and terminologies. So you can get a more accurate patient cohort as a result. The other thing that we would like to add is we are continuously updating and maintaining our precision sets. As new codes become available, we will update our precision sets to include those codes as well. So we take away the burden of maintaining these value sets from you, and we take the responsibility of maintaining that.
Hi, this is June, and there was a question regarding the codes for suspected and suspected ruled out. And there are the guidelines for ICD-10-CM, and again, each international code set has presented different rules and guidance for this exposures and the screening pieces. They talk about for cases where there's a concern about a possible exposure for COVID-19. However, after evaluation, it's been ruled out. That is the Z03.818 for ICD-10-CM. That where there are cases there's an actual exposure and who's confirmed or suspected, and that the test results are negative or unknown, that there is an existing Z20.828, the contact with and suspected exposure to other viral communicable diseases. And so that's why there's various clinical scenarios that the guidelines address. And so for this specific code will be dependent upon the context information, where because even if patients present with signs or symptoms, those could be captured or should be captured along with the Z codes for those suspected contacts or exposures too. And even to kind of talk about asymptomatic individuals who test positive, then the code assignment changes to a U07.1 to capture that. So while the specific code, again, is going to depend upon your specific patient encounter and population, those are what the codes in general, where some of those existing codes in ICD will come into play.
I see a question. Any precision sets for social determinants of health, SDOH, growing field? I agree. This is something that we have been hearing a lot about and have been doing a lot of research on. We do have IMO Precision Behavioral Health set, where we do have value sets to address unhealthy alcohol use, opioid disorder, and mental health. But definitely there is room to grow. And if there's anything you can share to help us with our research, we would appreciate that feedback.
Just a reminder, if you have any additional questions, put them into the questions box.
There's a question about updating.
Oh, go ahead.
Sorry, there's a question about updating from IMO IT Plus. You should have contact information for IMO support, and that is the most streamlined way to get the answer to your question.
Someone asked, where can they access IMO COVID-19 sets? And in the follow-up email after this webinar, you will receive a link to download. All right, I think we are going to end the webinar for now. Thank you so much. We hope you found it valuable, and thanks for attending, and I hope you're safe out there. Thanks all.